It's care that could mean the difference between life and death.
I don't think life-saving is an exaggeration at all.
Those are life-saving.
It's life-saving care.
35-year-old Errol Royston lives in St. Louis. He says he's been on testosterone for 8 years now. When he heard about an emergency order filed by Missouri Attorney General Andrew Bailey, he says he felt like it was an attack on trans people.
So my mind is trying to comprehend all of it. So the first part was anger. The second part was just how do I help my community? Then thirdly, it was what am I going to do?
Legal experts say Bailey's order, if put in place, will be the first of its kind restricting access to gender-affirming care for all trans people in the state, including adults.
No government official or legislature in the United States has gone as far as trying to stop adults from accessing care.
Requiring those seeking gender-affirming care in Missouri to meet a list of criteria before getting treatment. It includes 15 one-hour-long therapy sessions over the course of at least 18 months and having any mental health issues treated and resolved. The rule excludes people who are currently getting treatments as long as they and their doctors comply with the new rules.
When human rights are under attack, what do we do?
In a statement to NBC News, the Missouri Attorney General's office said in part, "We will continue fighting for all patients to have access to adequate health care." Across the country, legislation limiting or banning gender-affirming care has largely centered around children, with at least 12 states passing laws this year. But rights groups worry efforts are now moving beyond minors and increasingly on patients over 18.
There is a concerted effort here to erase trans people from public life. His rule would go into the doctor's offices of adults and interfere with the ability of adults and their doctors to make medical decisions.
These 7 states have bans on Medicaid coverage for gender-affirming care. And in at least 5 states, Republican lawmakers have introduced bills to limit access to gender care for minors and young adults, in some cases for people as old as 26. But studies have shown that transition care can be life-changing for trans adults. According to research published by the NIH, gender-affirming hormone therapy had a positive psychological, physical, and social impact on transgender individuals.
The biggest farce is identifying the treatment as experimental. We're not looking at true outcomes. Reduced suicide, reduced anxiety, reduced depression. Those are life-saving.
For Royston, having the access to his treatments has made all the difference.
If I was not able to get that care to be who I am today, I probably wouldn't be here. If I could have transitioned early in life, there's no telling where I'd be now. I'd be rich somewhere because I'd have nothing holding me back.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.